Hello, my Red Tribe, and welcome to another episode of Dr. Red Diaries. So today we'll be talking about something very interesting. I was having a conversation with a friend of mine, and this was a topic that we were discussing, so I decided to share it with everyone today. It's pre-wedding medicals. So I'm sure most people will be wondering, why am I discussing pre-wedding medicals, or why is it even important? I think I've had so many loved ones get married recently, and it has always been like a very important conversation that they tend to ask, oh, Dr. Red or Dr. Debbie, which tests can I do before getting married, and so on and so forth. And most time people care so much. People are so focused on the wedding, planning the wedding. This is one particular aspect that they tend to forget. Why? Because it's part of what builds the foundation of the marriage one, and even builds the marriage even during the process. Why? Because a lot of people tend to face a lot of health challenges while married, even before they get married. I don't tend to discuss or find possible solutions around it. So we're going to discuss that today. Let's dive in. Okay, so why is pre-wedding medicals important? Why does it matter? Before, in as much as weddings are sweet, they are interesting, they are fun, but health is more sweeter, and it's important for both parties to be aligned. You can't build a forever on vibes alone. You need information, you need truth, and you need medical wisdom. So pre-wedding medicals are not just a test of love. They're also a test of readiness and preparedness, if I'm going to use that word. They help couples to be able to identify some health issues or health condition that can affect their marriage, fertility, or even the health of the future children. So in Nigeria, for example, I've seen couples break up after discovering, for example, maybe they are both SS, or they are both AS, or they struggle with other fertility issues, or with infection, or things that they didn't detect early or have important conversations about. So we're going to dive in immediately into the essential tests. Let's start with that. So what are the basic tests to actually do for pre-wedding medicals? The first one, which on the top most, is always the genotype and the blood group. Is a very common test. So it's a test to do. Most times I tell people to do it even before the wedding. Before I even go into the test, let's maybe talk about when to even do pre-medicals. So it's better to do some of these tests, or most of them, 3 to 6 months before the wedding. So while you're planning, you're putting everything together, getting the location and event and everything, this should be factored into it. So what are the tests? Let's start from the basic ones. The first one I said, genotype and blood group. You need to rule out some sickle cell disease compatibility, rule out the rhesus negative, especially for the mother. If the woman is rhesus factor negative, it's important for us to check for the man to avoid cases of the child having neonatal jaundice, having and jaundice sometimes can even be very complicated, especially when the mother is rhesus negative and the father is rhesus negative. It is very, very important. So another common test to do is full blood count. A lot of people don't do full blood count, and I don't know why. A lot of people don't do full blood count. They do mostly genotype, blood group, HIV, hepatitis B. Those are important. But I also think it's important to do full blood count, even fasting blood sugar, or do a random blood sugar test. Why? So that you can, again, rule out long-term medical conditions like diabetes, hypertension, that will lead to stroke or lead to complications. So you don't have issues where you are now married, the person has not really been taking care of their health, and you are now placed in a situation where you have to take care of a sick person, or something tragic happens and you are now forced to take care of a sick person. Now, this is aside from any other thing that would happen, but I'm referring to things that can be prevented, that can be discussed, that can be controlled, so you are aware, and then you start the necessary treatment and preparation. Okay, some other basic tests. that we can do. I mentioned full blood count. You can do urinalysis. So these are tests that people don't necessarily think about. Tests that people will say, oh, they are simple tests now, but trust me, they can rule out a lot of medical conditions. So it can be discussed beforehand. On that test you need to do that is under the cadre of hepatitis B and HIV is the VDLR test. So it's called VDRL test or syphilitic test. So you tend to rule out some sexually transmitted infection. And again, it's not to catch anybody, but like I said, to prepare yourself and have a clear understanding of what the both of you are going into. So now let's discuss some uncommon tests, which I have not really seen people actually do. So these tests, I call them hidden gems because they are very important. They are rarely discussed. And they are one of those tests that I've seen break some marriages, actually, regarding health condition. Number one test is called thalassemia screening. So it's a test where you check some hereditary or inherited blood disorders, aside from sickle cell, aside from severe anemia, aside from leukemia. We're referring to some long-term blood condition that can be detected during pregnancy, some long-term blood condition detected even before pregnancy. Okay, so another test to do, which is not common, is something we call tests like chromosomal or genetic compatibility test. So we have something we call karyotyping. So karyotyping, or we call it CMA. So that's chromosomal microarray analysis. So that test can detect chromosomal abnormalities like Down syndrome, some congenital anomalies. I have seen several couples that did not do this test and they gave birth to children with so many congenital anomalies, and I don't even want to explain what happened. We all know what happened, because the child couldn't even live longer than maybe 2 days or so. Yes, we can remember. And several others like that. And sometimes these children, either the parent grow up to resent these children or vice versa. So sometimes it's just best to have this information and prepare your mind ahead. So we have chromosomal abnormality test under this list. So we have tests for miscarriages. You can actually do a testing to find out, especially during pregnancy, if it will lead to miscarriage, for infertility, for any other disorders that would come up in children. It is very, very useful for couples with a family history of any congenital anomalies. So if you have family history of maybe Down syndrome, or for women from the age of 35 and above, in the medical world, we call, if a woman is 35 and she is pregnant for the first time, we call them elderly primigravida. It means that you'll be thinking elderly, yes, because from the age of 35, there are several other factors that start affecting the egg or even the female reproductive system. So always advise women around that age or with family history for both ends of any chromosomal abnormalities to do this test. So another test that is important is a test called the cystic fibrosis carrier screening. Is also an hereditary test. This is, I'm mentioning, a hereditary test or genetical test or any family history of this. We've had couples that have were supposed to get married, but because one party had cystic fibrosis, and it's quite common in Nigeria. A lot of people don't actually know that cystic fibrosis is quite common in Nigeria. And the man had it, but he never had that conversation with the lady. So I think like a week or 2 weeks to the wedding, he fell ill. They had to rush him to the hospital. And then while they were doing the conversation and the consultation with the said doctor, the doctor was like, is she aware? And she was like, aware of what? And then that was where the conversation came up that, he has cystic fibrosis, and there is a possibility that over the years, over time, he may not be able to walk, he may have some other issues and come up with several other problems. And this was not discussed during their number of years of dating. It was never it was something that he tried so hard to hide. But the question was, when they get married, they're going to be living together. What was the plan? Were they planning to, was he planning to spring that information on her? I think it's important to have this conversation so that you don't, you give people the opportunity to make their decision, and you give the people opportunity to actually choose. So another group of tests, which is very, very important, are fertility screenings. So fertility screenings are also another test that people tend to shy away from. Why? Because they say, oh yes, I know we're very spiritual, for example, in Nigeria, and we definitely believe in either the power of miracles or God doing certain things. But again, it is very, very important not to put people in a very uncomfortable situations where they are forced to do something, or to live a life, or to adapt a particular condition they are not supposed to adapt to, or they don't want to adapt to. And especially if these situations are things, or conditions are things that you can easily detect on time. One, you can easily treat earlier and find possible solutions and discuss around it. And it's one conversation for this fertility or infertility, is one conversation that I think is not discussed enough. That should be discussed a lot of time before the wedding. So let's talk about fertility testing. One of the first tests for women, basic one, I'll start with the women before I go to the men. For the women, we're talking about doing a pelvic ultrasound scan. Most people, when they do pre-wedding medicals, they don't do scans, and I don't know why. I always say it is very important. You can do an abdominopelvic scan. That's a full scan of the whole abdomen, including the pelvic region where the female or the reproductive system is. So you can do an abdominopelvic ultrasound scan. Then you do hormonal profile, where you have the different hormonal panels. So you can run a full hormonal panel just to have an idea of whatever other medical condition, especially if you've had previous histories of irregular menstrual flow. It's important to have a hormonal profile done before the wedding. Let's even assume you've never done it before. It's important to have it done before the wedding. So on that test that you can have done under that for women, we have the AMH, that's the anti-Mullerian hormones. It's best to do to check for your number of eggs that are left. That's the best. That's how you check for it's an ovarian test where you check for the number of eggs left. Then you do your progesterone test to also check for that, if the ovulation is truly happening. Because a lot of women are not ovulating, they're not aware. They're not even aware of the test to do. So progesterone day 21 test is very important. Before the wedding, even after, during marriage, if you're having issues with fertility, you can also do this test too. So we also have the thyroid function test. A lot of women don't know that the thyroid gland can affect fertility a lot. So if you've done every other test and you've not done the TSH, thyroid stimulating hormones, and every other test, please do your thyroid function test if you're a woman. There's a possibility there's some abnormalities that may be causing the infertility you're currently dealing with. Then we have the HSG, is a very common test that people do, but people tend to do it after. I think it's best to do it before. HSG. So you do it before and check for any blocked fallopian tubes, for any issues with your ovaries, with the reproductive system. It's best to do it before. On that test you can do is the PCOS screening. Most time PCOS can present itself later on. We have a lot of, I always say sometimes, we Nigerians or females in Nigeria, women in Nigeria, sometimes we don't really pay close attention to our health. There are a lot of people that have had irregular menstruation, delayed menstruation, prolonged menstruation, and so on and so forth, and some other features that are similar to PCOS that are suggestive of PCOS, and they never had the screening done. So I advise, before you get married, do a PCOS screening. If the symptoms are present, do a PCOS screening just to rule that out. So now let's move to the men. So for the men, number one test, simple test, semen analysis. Check for sperm count, motility, morphology. It is very important. Another test to do, which I see a lot of men don't do, is scrotal ultrasound. While women are doing abdominopelvic scan, I've gotten this question, okay, what's the equivalent test for scan for women? For men, it is scrotal ultrasound. So you detect some issues, abnormalities with the vessels that helps to transport sperm and some other structural issues. Then you do hormonal profile. Yes, men do hormonal profile. Hormonal profile is not only for women. There are tests to check for men that can affect fertility for men. Testosterone, FSH, luteinizing hormone, even prolactin, because we've seen men that have big boobs over the years because of weight, and then men do develop breast cancer. Yes. And then they tend to develop milky discharge from the breast. It is not a common thing, but it happens. And we've seen that to be a factor too that would affect fertility for men. And also do genetic testing. You do the Y chromosome testing to detect any inherited male infertility issues. And also on that test to do too, for both male and female, which I didn't mention for women, is the STI panel. We have the chlamydia, gonorrhea. So it's important to have those tests done because they can silently cause infertility. Okay, so let's talk about, let's say, for example, you've done the tests. That's the next phase now. You've done the test, and then what happens if there are some incompatibility or chronic illnesses, diabetes, hypertension, and so on and so forth that wasn't detected before? So I don't think these are deal breakers, actually. I think they are conversation starters, especially if you do it earlier, like I said, between the 3 to 6 months marker. Then they are conversation starters, so you can start looking for solutions on time. So even if it's low fertility, risk of a genetic condition, they are conversation starters. Have that conversation, discuss it, and ask yourself, are both of you emotionally ready to deal with whatever the results may be, whatever issues may come about? And that will even give you an idea if your partner is going to support you. So that will also give you an idea if your partner is going to be present to deal with whatever challenge. So you're having a full round conversation. And I also advise that when you go for the test, it's best to do the test together. So it builds trust and accountability, and then use, of course, reputable hospitals and labs to run this test. And aside from doing this pre-medical, something they call post-medicals consultation. So post-medical consultation, you've gotten the tests, you are going to be discussing with a qualified medical practitioner to have a all-round overview of the results, especially if there are issues. If there are no issues, fine, perfect, that's good, please go ahead and carry on. But if there are issues or something that they might detect due to several factors, the medical professional will give you that information. So you would have that information, discuss it, put it together, and make a very coherent decision, and make a collective decision that, okay, this is what we are going to do, this is how we are going to do it, so you are able to deal with it. So like I said, it's important to have this test done. If you're planning to get married in the next 3 months, 6 months, or even 2 weeks, or even 1 week, you can still get this test done, especially the ones that you did not consider doing. There are some tests I mentioned that a lot of people have never done. Get those tests done, put them together, have the conversation with your partner so you can start getting possible solutions to the problem. So to every couple listening right now or watching this video, build your marriage on truth, health, and mutual respect. And please don't let your first serious health conversation happen in the delivery room or 2 years or 3 years down the line into your marriage. So thank you so much for watching today's episode. I'll see you on our next episode. Once again, this is Dr. Red Diaries. Bye.